السلام عليكم ورحمة الله ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا مراجعة أسئلة اختبارات البرومترك Review of Barometric Test Question. This is lecture number 21 in Maternity and Child Health and number 60 in Ghaith Review. Today we are going to discuss 5 questions from question number 317 up to question number 321. This is Muhammad Usman with you. Question number 317. A 25 weeks pregnant woman who is gravida comes for her first antenatal visit. During the history and physical examination, the midwife discovers that her husband has sickle cell anemia minor. What should be the most appropriate plan of care for this patient? The options are number A, genetic counseling, number B, identify the severity of the disease, number C, discuss the chance of inheritance, number D, amniocentesis to identify genetic abnormalities. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number A, genetic counseling. ليش اخترنا الخيار رقم A؟ نشوف rational. Genetic counseling is essential in this situation to evaluate the risk of passing the sickle cell trait or disease to the baby. Since the husband has sickle cell trait, it is essential to test the woman for her sickle cell status, whether trait or disease. So the correct option is option number A, genetic counseling. The option number B, identifying severity of the disease, is not correct because the husband has sickle cell trait, not sickle cell disease, which is usually asymptomatic. And regarding to the option number D, discuss the chance of inheritance, is correct, but is not the most appropriate because discussing inheritance is part of genetic counseling and should be after confirming the woman's career status. And regarding to the option number D, amniocentesis to identify genetic abnormalities, it is not the first line approach in this case. Question number 318. Which of the following statement best describes puerperal infection or postpartum infection? The options are number A, presence of fever of 38 centigrade or higher after the first 24 hours during the first 10 days postpartum. Number B, presence of fever of 40 centigrade or higher during the first 10 days postpartum. Number C, fever accompanied by full smelling lochia within 24 hours postpartum. Number D, fever lasting more than 12 hours with abdominal tenderness and chills during postpartum. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number A, presence of fever of 38 centigrade or higher after the first 24 hours during the first 10 days postpartum. ليش اخترنا الخيار رقم A؟ نشوف rational. Presence of fever of 38 centigrade or higher after the first 24 hours during the first 10 days postpartum for at least 2 days is the standard clinical definition of puerperal infection. So the correct option is option number A. Regarding the remaining options are not correct. Why? Because the definition of puerperal infection is based on the duration of fever and the specific temperature threshold, which is 38 centigrade or higher. Question number 319. When would the nurse schedule a woman for glucose tolerance test? The options are number A, 6th to 10th week of pregnancy. Number B, at 12th to 16th week of pregnancy. Number C, at 21st to 28th week of pregnancy. Number D, at 32nd to 36th week of pregnancy. وقف الفيديو هنا واختار الخيار بالشيء الصحيح. The correct option is option number C, at 24th to 28th week of pregnancy. ليش اخترنا الخيار رقم C؟ نشوف rational. The glucose tolerance test GTT is typically performed during the 24th to 28th week of pregnancy to screen for gestational diabetes, because this is the period when insulin resistance tend to increase due to hormonal change in pregnancy, making it the ideal time for testing. So the correct option is option number C. Early testing that before 24 weeks is only done if the woman has risk factor like obesity or a history of gestational diabetes. Question number 320. A newborn is diagnosed with developmental dysplasia of the hip DDH and is using a public harness, this one, as treatment. Which of the following mechanical factors is associated with DDH, developmental dysplasia of the hip? The options are number A, intrauterine bridge position. Number B, cesarean section. Number C, small infant size. Number D, single fetus. وقف الفيديو هنا واختار الخيار بشو صحيح. The correct option is option number A, intrauterine bridge position. ليش اخترنا الخيار رقم A؟ نشوف rational. Developmental dysplasia of the hip is strongly associated with the intrauterine bridge position, which can place abnormal pressure on the hip joint, leading to improper alignment or dislocation. So the correct option is option number A. Regarding to the remaining option, cesarean section, small fetus size, or being a single fetus are not directly linked to DDH, developmental dysplasia of the hip. Question number 321. A relative of a 25-year-old postpartum patient advises her to avoid bathing until 40 days postpartum and provides a diet high in saturated fat, claiming it improves milk production. What should be the nurse's priority when addressing the patient's understanding of postpartum care? The options are number A, a healthy and balanced diet is beneficial. Number B, breastfeeding is not affected by the mother's diet. Number C, maintaining personal hygiene is most important. Number D, rest and relaxation are necessary to recover. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number A, a healthy and balanced diet is beneficial. ليش اخترنا الخيار رقم A؟ نشوف rational. The nurse's priority should be to educate the patient on the importance of a healthy and balanced diet to ensure proper recovery and optimal milk production. So the correct option is option number A. Regarding to the option number C and D, maintaining personal hygiene and rest and relaxation is essential but secondary to addressing misconception about diet. The emphasis on saturated fats and avoidance of biasing is outdated and not evidence-based. And regarding to the option number B, breastfeeding is not affected by the mother's diet, this is not true. شكرا جزيلا. نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.